Hi, my name is Dr. Simone. I am a medical doctor living with sickle cell disorder, and I am sitting here trying not to laugh too hard or cry because today, Friday, August 26th, is Sickle Cell Medical Advocacy's 1 year anniversary.
Okay.
And you guys, if you knew the journey, you would be laughing hard or probably crying along with me too. Um, I did not plan on starting a nonprofit organization last year in August. Um, but I found myself flat on my bed one night and just praying and um, asking God what I needed to do to address this immense problem that I was seeing of patients getting turned away in the emergency room when they present in incredible pain for a pain crisis that is um, characteristic of sickle cell disease, and being turned away and escorted off the premises by security guards, things that are just unacceptable. And you would not have believed a patient if they had told you that this was happening. And the patient knew that. And so the patient would videotape things like this. And I was hearing and seeing that all year long and thinking, I cannot sit by and let this happen without doing anything about it. And I was trying to do something about it in my own way, but it was becoming clear that that wasn't going to be the right way to handle it. And so I had no other choice but to start an organization. And I am a medical doctor. I take care of patients. I do not run companies. And so the thought of running an organization made me want to throw up. I am so happy that we went ahead and started this organization. There were bumpy rides like everything else that you start that you don't know much about, and you have to learn along the way, and the learning curve is sometimes steep, but I would not do anything differently in terms of starting this organization. I'm grateful that we did, because as soon as it was official and people knew we were here, people started finding us. And the reason they did was this. Earlier on, I had made a video where I explained to people that I was diagnosed with sickle cell SC. There are many different genotypes of sickle cell disease, and there's SS that is more common to people, where your hemoglobin falls and you present to the emergency room and you're anemic and things like that. I had a different genotype where you didn't always present to the emergency room like that. And so oftentimes when I would present, I would be in severe pain, but people would look at my blood work and see that I had a high hemoglobin of 9. And actually, 9 is not, uh, you know, high, but it's high for someone with sickle cell disease. And so, they would say, "Well, your hemoglobin looks fine. You are can't be in a crisis." At that time, they didn't know that you could have a vaso-occlusive crisis that just blocked the vessels without breaking the red blood cells. And so, of course, you could have pain without um, having any anemia uh, that you would determine in your blood work. And of course, you could have tissue damage if you have blockage. So many people were presenting like that and getting turned away. I experienced some of the most horrific treatment in the emergency room because of that. And I thought to myself, if this could happen to me as a medical doctor, I could just imagine someone who couldn't advocate for themselves. I mean, if this could happen to me as a medical doctor that knew what to say back, what was the fate of someone who had no medical background? And I learned what the fate of those people were later. But because of what I experienced, I realized that there was something broken in the system. The other thing that I had noticed is that you could go from one hospital to the other and get completely different care. You could go to one hospital and they don't even have a pain protocol. They will tell you that there are no sickle cell guidelines. And then you could go to another hospital and they understand sickle cell disease. They whisk you in, they start treatment within the hour, and you're on your way to healing and staving off more damage to your body. It was that vast. Because of that, people just kept getting terrible care. I got terrible care until I finally decided, you know what, I am going to tell everybody that I'm a medical doctor. And that only happened a few years ago. But once I did, then people started saying, well, why didn't you tell us that? Why didn't you um, self identify so that we could direct admit you to our hospital? And I thought to myself, well, if you could direct admit me, why don't you go ahead and just direct admit people when they need to come in and they know they need to come in? Why would you have them wait for hours in the emergency room? But you're extending this red carpet to me. And I started realizing that because there was no standardization that the doctors were working with, everyone was just doing their own thing. It didn't matter that there were guidelines for sickle cell management in the emergency room that was made by the NIH or the American Society of Hematology. They just, some of them didn't even know it existed. And so with that, I decided that I would try to help other people when they would post into these private groups about the fact that they were getting horrible care. I could listen to and tell was unethical. And so I started picking up the phone and calling these patients and asking them where they were located all over the country. And they would tell me, and I would call and speak with them, and people would suddenly get better care. And it was sad because that's all I had to do. I could do that even when I was sick in bed, and I was often sick in bed. But because I saw what an impact I could make, even from my bed, I knew that I had to do something more. So I created at the end of 2020, after something horrific happened with another close friend of mine who almost lost her life and made it out with just losing her womb. But after that happened, I sat down, that was towards the end of November. I sat down that month of December and actually wrote out um, a curriculum for teaching people how to advocate on behalf of a patient with sickle cell disease. And then I finally opened sickle cell medical advocacy in August of 2021. That's what I was planning to teach. And with the people that would learn that, I was my plan was to pair them with patients and have them virtually accompany those patients to the hospital and advocate for them. And so that's what we do today. I have 1 year later been able to do that for many people, and I'm so grateful and honored that they trusted me with their lives to be able to do that. Um, we are at this point in our journey finding people who are nurses and doctors that they're coming to join us. So we have nurses who will call and say, this week, that said, listen, and I just saw the worst treatment of this male patient with sickle cell disease. And I went online and looked for a sickle cell advocacy group that I maybe could volunteer my time or something, because I felt so helpless in that situation and I wanted to be able to do something about it. And we came across your group, right? And I want to volunteer and do whatever you want me to do, whatever is needed to make this situation better. Isn't that amazing? We're at the point now where people are finding us. And I, first of all glory be to God, because I believe that regardless of who you are, you can come regardless of your faith, regardless of your race, regardless of your beliefs. If you have sickle cell disease, we welcome you and we want to help you. But we also are firm believers that we are not the only one wanting to do this altruistic work. There are plenty of other people. And one day they're going to get fed up and they're going to go looking for, where can I just join forces and get this work done? And they're going to join forces and will get the work done. And there are other amazing organizations that are doing other parts of this work that I just applaud, because we need everybody doing a part, each their part, for us to be able to roll this big boulder up the mountain. But it is getting done. And one day we will look up and we will see a different way of managing sickle cell disease, a different way of treating patients with sickle cell disease, and a different way of living with sickle cell disease. I want to give honor to the people that started this organization with me, Anakin Yuan, my husband, a good friend, Cynthia James, who is also living with sickle cell disease but has been fortunate in her life to not be symptomatic and believes that it is because she was meant to help. People like Marissa Richards, who helped to create my website and launch the website. People like Lena Harvey, who is my administrative assistant, doing a little bit of everything. And I know that I am probably missing so many others, but I appreciate my board, people like Dr. Pierre Fazzo and Jenny Valentine and Rita Hoyt, and all of the people that are on that board that are there because they want to make something happen. They want something to change, and the eight of us, when we get together because we want to push the needle. We want to move the needle for sickle cell patients. I am grateful for what I get to do. I don't always have the energy, and that's why we delegate, but I am grateful for the fact that we could watch something like this grow. And even now we have another Dr. Joanna Pascal, that just joined us. Um, I'm grateful for her because it helps to share the strain in terms of the teaching part of the organization. Um, there are so many people, you guys, so many people behind the scenes. Names I know I have forgotten to mention, that roll up their sleeves every day to help do a little bit, a little part um, of this work. And so thank you so much for doing what you do. And I can't wait to see what next year looks like. Thank you.